Hey, this is my prenatal bleeding skills demonstration. I did my hypertension portion live during class, so this is the prenatal bleeding part. So my differential diagnosis is going to be different depending on gestational age, as well as my questions I ask and what we do about it. So first trimester bleeding can be implantation bleeding, postcoital bleeding, ectopic pregnancy, molar pregnancy, subchorionic hemorrhage, placenta previa, trauma, varicosity or hemorrhoid, spontaneous abortion, threatened spontaneous abortion, infection or cervical polyp, such as cervicitis, trauma, cancer polyp, or just trauma in general. Second and third trimester bleeding, we're looking for preterm labor, placenta previa, placenta abruption, and any of the above things I mentioned for first trimester, except for implantation bleeding and ectopic pregnancy, because those don't usually go beyond the first trimester. Okay, so the questions to ask are about symptoms. Abdominal pain is always the first question, including cramping or even low back pain that comes and goes. So assessing for actual contractions. I want to know if the amount of blood, the color, the consistency, how long ago did it start, how long has it been going, is she soaking through a pad? Is it just when she wipes or anywhere in between? The thickness, is there any other discharge? Is there clots? Is there tissue? Asking about all of those things. Fever, flu-like symptoms, other signs of infection, foul smell, and then if it's an ectopic rupture, I'm asking about abdominal pain that radiates to the shoulder, or just shoulder pain that is deferred, or urge to have a bowel movement is also a sign of a ectopic rupture. Is there any faintness, dizziness, weakness, anxiety, nausea and vomiting? So really severe nausea and vomiting can be the hydatidiform mole. Shortness of breath is also the hydatidiform mole. Pelvic tenderness, so either like dyspareunia or I would have her come in and do a pelvic exam if indicated. I'll talk about that in a second. And then palpitations or like tachycardia, asking her if that feels like that. I want to know her recent activity. Was there some kind of trauma, screening for IPV or a fall, a blow to the abdomen? Intercourse is really important to know. Again, when did it start? Is it less, the same, or worse than when it very first started? Any changes to pregnancy symptoms? So like in an abortion or spontaneous abortion, miscarriage, the pregnancy symptoms are usually getting less and less. If they're getting more and more severe, especially the nausea and vomiting, that can be ectopic or hydatidiform mole. And then if it's after she has already reported fetal movement, I would ask if there's fetal movement. And so we're looking for that abruption of placenta or second, third trimester things. If it sounds like abnormal bleeding without cramping and too early for heart tones, I would want to see her and we can do a full physical with all of her vitals and bimanual to test that tenderness, any infection testing or cervical cancer screening if it's indicated, and then send for ultrasound to look for viability or the subchorionic hemorrhage, ectopic molar pregnancy, fibroids. Those things can be found on ultrasound. If there is the bleeding and also cramping, then again, send for an ultrasound. We're especially looking for viability. I can also do serial HCG and regular CBC blood type RH if we haven't done it already. And again, any of the infection things. A lot of times UTI can do the cramping part, and then it could be like not related to a postcoital bleed or implantation bleed. So kind of keeping all of those things in mind and really focusing on the symptoms, her anxiety level, and what would make her feel better. And then if it's 10 weeks or so, offering to listen to heart tones. And if there's heart tones, the chance of a miscarriage is very small. So reassuring her that if we find heart tones or if in the ultrasound there is a heartbeat. I would offer emotional support, expectant management, medical management. So if it's ectopic, she may need surgery. If it's spontaneous abortion and she wants misoprostol to help pass it and help it go sooner instead of waiting for it to pass on its own. Obviously, if it's infection, antibiotics if needed, all of that. And then the second trimester, I'm just making sure I'm assessing for all of the first trimester things except the implantation and the ectopic, but then really focusing on ultrasound for previa or abruption, and then for preterm labor, doing an abdominal exam, seeing if there's contractions, and if nothing's been entered in the vagina, doing a fever fibronectin test. So that's my bleeding. Specific like things that would indicate different the diagnosis is if the bleeding is brown and clumpy, it could be a molar, or ectopic is brownish usually as well. Old blood is also brown, so knowing how much, if it's continuing or if it was just one-time wipe, all of that's super important. Subchorionic hemorrhage usually is a little bit of spotting and no other symptoms at all. Trauma, again, I would have to ask about IPV if that is happening, or if there was intercourse. So a friable cervix can bleed easily if she's entering something in her vagina. What else? Don't remember yet. Oh, varicosities and hemorrhoids would be like a visual exam to see if any of that, or if there was like burning, if it was related to pooping, and fullness in the vulva. It can be varicosities, anxiety, weakness, chills, and palpitations or tachycardia can all be the spontaneous abortion, and then infection, foul smelling, discharge, and flu-like symptoms. And then, so that's what I'm looking for. And we'll do what we need to do when we find out what it is.